Fears lives will be lost in the Northern Territory as a cluster among Indigenous Australians now grows to 19. Let's go to Matt Cunningham in Darwin. Matt, good morning. How widespread is the outbreak?
Well, that's the question authorities are trying to answer, Pete. We should get a clearer idea today when we start to get some of the wastewater testing back from the major towns, including Darwin and Tennant Creek. That's an area that's been identified as the Chief Minister as one of particular concern. We know that there have been 19 cases in this outbreak, 13 in Katherine and 6 in the remote community of Robinson River. But as Michael Gunner pointed out at his press conference yesterday, there are links between Robinson River and Tennant Creek, and obviously there are links as well, and a lot of people travel between Katherine and Tennant Creek.
The one place we did not see that lift was in Tennant Creek. There are strong links between Tennant Creek and Robinson River. We have not been able to take a wastewater measurement in Tennant Creek yet. This is a priority, but the wastewater test has not been taken yet. We need to see an increase in testing and vaccination in Tennant Creek.
The reason there's so much concern, Pete, is that there's a 9-day period where they believe the virus may have seeded in the Katherine community. It may have been transmitted to many people and then could have spread far and wide. There's basically 2 stages that they're talking about in this cluster. They believe that these latest cases are linked to an earlier outbreak that started when a 21-year-old woman flew to Darwin from Cairns. They say she lied on her border entry form. She'd actually been in Melbourne before flying to Adelaide, then to Cairns, then to Darwin. They believe that's where the outbreak started. We saw a few cases in Darwin and Katherine related to that initial case, but then there was a lull, a period of about 9 days where there were no cases. Then suddenly we had those 2 cases recorded on Monday night. So there are those 9 days in between. A number of exposure sites have now been listed where they believe people may have been infectious in the Katherine community. They include the Katherine Hospital and the Katherine Hotel. Contact tracing efforts are underway. Mass vaccination efforts are underway as well. We heard you speak to Malandiri McCarthy before about rising vaccination rates when there are cases. Now, we know those vaccination rates have been low in the Northern Territory. We are seeing them rise now, but of course it has taken an outbreak in a remote community for that to happen.
OK, Matt Cunningham, appreciate that. Thank you.